we can do to relax some standards, where we can make sure that we provide flexibility to get more people into this workforce. I had sponsored an amendment in the budget to look at the Mount Ida campus as maybe partnering with this flagship university to try to expand nursing and other healthcare positions in the state. You know, and Secretary Studders, to keep being a cheerleader for her, she's done so much on mental health and behavioral health. It goes back to, you know, we didn't often have enough beds in this state, but now we have beds, but we don't have people to take care of people in the beds. And that's our biggest challenge right now, to try to get people into this workforce. My mother is 87 years old. She'll be 88 in February. I called her on the ride out. She was a nurse. She left Ireland and went to England. It was a nurse in England for 6 years, and then came on a travel nurse to Boston and abstained. When I talked to her, I called her on the ride out, and I was asking more about the program she was in. She said, well, you can't really get much out of her unless you really pry at her. And I said, so you left Ireland? She said, well, the nuns at my school where I grew up had a friend who was at a hospital in London, and they were looking for nurses and said, do you know any young women who want to get into the nursing field? And so her and 3 of her friends ended up applying and going to London, and they did a 3-year nursing program in London. And you would go, she said, to school it was for free. And so when you think of all this financial aid, and she said the government in England paid for it, there was no restrictions on it. She said, we went to school for 6 months. We lived in nursing dormitories. We got a stipend every month. And after 6 months, you had 2 weeks vacation to go back, and she could go back to Ireland to visit her family. So, you know, we think of like the student loan debt and all the things that, you know, this world has figured out other problems in other ways. And, you know, a 10,000 student loan debt relief, and we think of how divisive it is. You know, we really have to start embracing other ideas on how, especially to get people into this workforce that's so desperately needed. And, you know, I always say to people at the State House when we talk about nursing, I said, you can't out-nurse me. My mother was a nurse, my mother-in-law, my wife, my sister, and now my daughter. And I was saying to Swami, I have triplets that are seniors in high school, and I'm hoping they will come here too. And one of them the girl wants to be a doctor. So I said, so that's, they're all staying in the medical field, which is so important to our family. But we're going next week to Ireland with our mother, and she's going to visit 2 of her friends who she went to nursing school with in London, who are back in Ireland. So next Monday, my 5 siblings and I are taking her on a plane to Ireland, and we're going to travel Ireland a little bit to her hometown, and so it'll be nice. But I really, really know that we all, as policy and stakeholders in healthcare, are going to have to work together to really solve this crisis that's been coming for a long time. The burnout factor in healthcare, especially in nursing, we know that nurses were really the lifeline of this pandemic and really taking care of our sickest people, and we really need to respect that. We're working on a workplace violence bill. We should have all our healthcare workers, it should be like a TSA agent. You don't ever put your hand on a healthcare worker. So those things that we have to do to make sure that we have the back of our healthcare workers, and we need to send that message. So I am truly honored to be here and appreciate each and every one of you in this healthcare and trying to do, and especially what Elaine has done, and really at this important time in healthcare. What a gift it is, and so thank you to the trustees of her foundation, because this is, I'm sure, what she didn't see was the pandemic, but what a time for a transformative gift like this to this great university. So thank you all.
Thank you, Representative Dome and Representative Long. Our last speakers are Karen Giuliano and Frank Supp. Karen and Frank are co-directors of the Elaine Marieb Center for Nursing and Engineering Innovation. Their collaboration focuses on advancing human health and wellness in leading transformational change in patient care, nursing practice, and medical product development. Karen Giuliano is a professor in the Elaine Marieb College of Nursing and the Institute for Applied Life Sciences. And Frank Supp is an associate professor in mechanical and industrial engineering. Please join me in welcoming Karen Giuliano and Frank Supp.
Thank you. As far back as I can remember, I have been driven by a deep curiosity about how things work. My father was a tireless tinkerer who could transform any object into a tool, always looked for better ways of doing things, and had a special knack for making work seem like play. These early experiences provided me with a determined can-do attitude, a habit of questioning the status quo, a tolerance for failure, and a restless impatience when told that things had always been done that way. My clinical practice has always included a propensity to play with ideas and do things differently. And my practice and clinical research interests are largely driven by a passionate desire to improve the delivery of care for nurses and the experience of care for patients and their families. Fortunately, my 20-plus years in industry-based medical product development provided me countless opportunities to work alongside my engineering colleagues, and it was through that experience that I realized the power of the nurse-engineer approach. The goal of the Elaine Marieb Center for Nursing and Engineering Innovation is to support nurse-engineer partnerships to tackle everyday healthcare problems. As Dean Forderstrauss noted, Elaine Marieb herself was an inspirational innovator who could see that things could be vastly improved. As nurses, we touch more products and are a part of more services than any other healthcare professional, making us the ideal clinicians to address everyday healthcare problems across every conceivable setting where care is delivered. However, unlike engineers, historically, nurses have not been empowered or encouraged to innovate. Most engineers, while tasked with innovation, often lack detailed knowledge of healthcare at the operational level. Thus, the ability to quickly and effectively develop and test healthcare innovations benefits enormously from combining nursing and engineering expertise. This approach is demonstrated in our center leadership with myself as nursing co-director alongside my engineering co-director, Dr. Frank Supp.
Thank you, Karen. It's really been inspiring working with you and developing this new center here on campus. Our centers are already realizing our vision in collaborative innovation. We've awarded our first 4 pilot grants to nurse engineering faculty teams. We have graduate and undergraduate students working within the center. And just this past summer, we had our first 4 Institute for Applied Life Sciences undergraduate interns, which was a first for our nurses in our program. And again, we have one of those here with us today, Jessica Smith. It was wonderful working with you. And most recently, Business West and Healthcare News have chosen Elaine Marieb Center for Nursing and Engineering Innovation as one of their 2022 Healthcare Heroes. The center is advancing 2 of its own major initiatives to assist in patient care. One is centered around healthcare robotics, specifically designed to support nursing workflow. And the other is on our IV Smart Pump initiative, focused on improving their safety and usability. And our work has already been nationally recognized. Tomorrow, we're especially excited to host our first annual symposium in the new student ballroom, where attendees will learn even more about everything we're doing at the center, and we invite you all to join. Finally, we reiterate our thanks to the University of Massachusetts for supporting our center vision, and most sincere thanks to the Elaine Nickpon Marieb Charitable Foundation, whose generous support will allow us to realize the full potential of the nurse engineers innovating together. This important interdisciplinary effort reflects Elaine Marieb's legacy of boldly challenging precedent that was the hallmark of her extraordinary career. Thank you so much for joining us today to recognize Elaine's ongoing inspiration for our students, faculty, and our community. Thank you.
Thank you, Professors Giuliano and Sup. I would like to thank you all again for being with us today to celebrate the dedication of the College of Nursing in Dr. Elaine Marieb's name. We'll hope that you'll join us in the courtyard at the conclusion of the event to enjoy refreshments and jazz music provided by UMass Amherst students Sandra Azalea, Ethan Nee, and Tess McGuire. Music was an important part of Elaine's life, and she had a particular love for jazz music. Before we close the formal program today, we have one last item of business, an unveiling of the portrait of Elaine Marieb, hanging in a place of honor at the front entrance of Skinner Hall. Will the following people please join me in the lobby? Dean Vorderstrass, Chancellor Subaswamy, President Meehan, Secretary Sutters, State Representative Joe Lawn, Martin Wassmer, Libby McHugh, and Professors Giuliano and Sup. There's not much room in the lobby, but you're welcome to follow us and join us in Skinner Hall at the reception. Thank you for being with us today, and go UMass.